Hello, everybody. It's April the 29th, and this is our briefing. The reason we delayed it today was to be able to go after 5 o'clock in hopes that we were going to have good news for you, and we do have good news, and I'll get to that in just 1 second. First of all, and again, I don't care how many times that I've got to announce this, I'm going to do it the same way, and I'm going to do it respectfully and everything. We've had our 38th, our 39th, and our 40th death in the state of West Virginia because of this dreaded disease. We lost a 50-year-old woman in Jefferson County. We lost an 80-year-old male in Kanawha County, and a 95-year-old female in Wayne County. I've got to tell you before I go any further just this, that of our 40 deaths that we've had, again, if you look at it from a statistical standpoint, our surrounding states, the state of Ohio has 799 deaths. The state of Pennsylvania has 2,059 deaths. Kentucky has 225. And Virginia has 522. And I don't see Maryland's. Maryland has 1,016. So if you look at it just purely from that, the bordering states to us are, many of them are in the thousands, and we're at 40. But I tell everybody over and over and over, this is a mom, or this is a dad, or this is a brother or sister. And absolutely, they all have names, and we should absolutely keep them all in our thoughts and prayers, so please do so. Now, the other thing I want to tell you is just this. The average age of a person that we've lost in West Virginia is 78 years old. We've had 35 die from the age of 65 to 98 years old. We've had 4 die that were from 50 to 65 years old. And I hate like crazy, we lost a young man that was 25. Now, what does that tell us? It tells us ever so clearly one thing. This disease is after our old and after those that have been with us a long time. We got to protect them. We got to protect them in every way. So I couldn't stress enough to everyone, we have got to help our elderly. Now you get that. I know you get it because our numbers are so low. But this disease is not going anywhere, and it's going to be with us, and we're going to have to live with it. I have said that over and over and over. We can't sit back and not reopen. We can't sit on our hands and just dwindle away, because bad things will happen then as well. But as we reopen, remember just how absolutely vulnerable that our elderly are. You got to help them. Help them at the grocery stores. Help them in every way you possibly can. Social distance. Wash your hands. For crying out loud, if you're going to be in a crowd of people, you have to wear a mask. I would be a proponent of you wearing a mask at nearly all times if you possibly can. When you're outside and you're around people. Absolutely, you have got to take care of our elderly. Now, the other thing I would ask our stores to do as we begin to reopen, and our stores that have already done, a lot of them have done magnificent work already, but I would ask that they just do this. Could you try to open, not necessarily earlier in the day, but reserve a couple of hours in the beginning of your day where our seniors could come and shop and everything before the stores were open to many others. Now, I'm not mandating that you do that, but I am suggesting and asking you to do that because that's the time of the day that our stores are at their cleanest. Because most stores through the night is when we do most of our cleaning. And so at that time, if we had our seniors come in then, it would be the safest time for them to be able to get out and come to the stores. Now today is a remarkable day in that we've been through a really tough time, a pandemic, something that no one has ever seen before in our lifetimes. Now, but as we are beginning now a new chapter, a chapter to reopen the comeback of West Virginia Strong. As we reopen right now, we had to have 3 days that we had a barometer, a metric, and that metric was just this. We had to be under 3% for 3 days. The first day, I think we came in at 2.69. Then we came in at 2.66, I believe. Today's our third day. Today we're coming in at 2.59. So tomorrow officially opens West Virginia for the week one businesses that were in addition to the elective procedures and the hospital stuff. So the week one businesses may begin operations effective tomorrow. Now, this is West Virginia's second chapter. We've knocked it out of the park. I was on a national show just a little while ago, and I said, we have witnessed the miracle of West Virginia. And I said, the miracle has been you, West Virginians. You've listened. You've responded. You've kept your distances. You've absolutely used all the correct hygiene. You have absolutely punched all the right buttons as we've gone along. And you've produced numbers right in the middle of the hottest bed that there could possibly be that are unprecedented. Now we got to do more. Now we got to do more. Now we got to bring our state back to life, and we've got to move towards bringing our state back to being able to resemble some type of normalcy. Now, in doing so, now I ask you again, West Virginians, do what you've done. Absolutely wear masks. Absolutely keep social distancing. Help us if there's people that are not trying to comply and there's people that are doing things that they shouldn't do. Tell us. But West Virginians, help the elderly. Help in every way. We are moving towards in week 2, and I think, Jordan, if you'll show week 2 up on Thursday, April 30th, which is tomorrow. Week 1 will officially begin for all those outside what we've already put in place last week, which was the electives and all that the hospitals can do now, the elective surgeries and all that they can do effective yesterday. Now, in week 2, which will begin on May the 4th, week 3 through 6 will begin the following Mondays, and businesses opening weeks 3 through 6 will be announced the week before. We'll give you guidelines and the businesses and the whole bit. I've got just a few other announcements, and then we'll go on to our people. We have now tested all the residents and staff at our veterans nursing home and facility in Clarksburg. 100% tested negative. 306 were tested. The DHHR on the hospital approvals that have been approved to go back to work, there was 39 hospitals and 5 surgery centers. I've got just a couple other things real quick, and that is this. And I'm going to mispronounce this, but I think it's FAFSA. But students that are planning to attend college this fall, you have, or another type of higher ed, you have till May the 15th to fill out information that qualifies you for higher education grants. An awful lot of you are not doing that right now. And a lot of you are probably preoccupied by this terrible virus and a lot of different things on your minds. Do I really want to go to college? Is it safe for me to go to college? But I would urge you, whether you go, whether you don't, I would urge you to follow this screen right here. And I would urge you to go ahead and sign up now so you won't miss this window. I guess the last thing that I'll say right now is just this, I keep reminding you about the census. Don't drop the ball on that, West Virginia. We got to count everybody. Every single person needs counted. All those dollars mean so much to West Virginia, and it gives us the ability as we go forward to be able to help you, protect you, do all the different things that we can do. We don't want to leave money on the table. And I've asked you as West Virginians to absolutely call upon your neighbors, call upon your relatives, call upon whomever to be able to make sure that some way, somehow, all of us are counted. I guess at this time we'll pass to our experts, and Jordan, you can take over from here.
All right, thank you, Governor. We're now going to take comments from a few of our panel members. Up first today, we have Dr. Clay Marsh, our coronavirus czar.
Well, hello. It's good to be with everybody this evening. I have a few comments I want to make. First of all, Governor Larry Hogan of Maryland has followed suit with Governor Justice and decided to universally test all nursing homes. So I think this once again demonstrates the leadership that our state and our governor has illustrated. And I think that many states will be following in tow, but West Virginia was first. And I think that that's been a very important decision, since that is our most vulnerable population. And in many studies, and including in our experience, accounts for a significant number of deaths from people who are COVID positive. The second thing is I have been somewhat active, more than usual, on social media, and particularly Twitter. And I've posted a new article by Thomas Puyo, who's an engineer from California, and he deals with a lot of data. And what he's demonstrated, which I think, again, really illustrates even additional rationale for the metric that we are using, the governor has really challenged all of us to stay with, is having a test rate of the percent positives 3% or less. And Puyo, in his article, and I recommend you take a look at it, identified countries that do much better with both the case investigation and tracings, as well as with reopening and doing well with the virus. And he suggested that having a positive rate of 3 or under is a real mark of that success. And you can either do it by increasing your testing until you test about 33 times more people that are negative than positive, or that your base rate stays under 3%, because it gives you an opportunity to be able to identify very clearly the people that become infected and be able to sort of jump on them. And at the case tracing level, at least I know as of last week, our average number of contacts that had to be traced was only 3. So that really does, with the low number of percent positives and with the idea that we don't have a tremendous number of contacts with our cases that test positive, really gives us a great advantage moving forward, and suggests that we should be able to navigate better than perhaps any other state. As we follow a number of different metrics, I just wanted to update people today. The R0 level, which is a number that demonstrates how many new people will likely be infected by somebody who newly gets COVID-19. And our number is down again today. It's 0.74. Anything under 1 means a person with COVID will infect less than a single person. Germany is following that number and ended up going up to about 0.98. and they started to shut things back again. So that's a very good number for us. A couple more updates. There is a vaccine that's been produced from the Oxford Group in the United Kingdom, and this is basically using a targeting approach against the spike protein on the corona virus. And the reason why coronavirus is named corona is because it's got little spiky projections like the sun, a halo, or a crown. And the vaccine is against that spiky projection. And it's an exciting finding that 6 rhesus monkeys were injected with the vaccine and then challenged with the coronavirus. And that's a very close connection with people. And they were fine 28 days later. And so that gives us some hope that maybe this vaccine might be effective. And the other thing is, even Anthony Fauci, who's generally been a bit more somber about this, is excited today because a drug from Gilead called remdesivir is an antiviral agent that was made against Ebola virus to begin with, and it blocks viral RNA replication, and it showed very promising results in a randomized study that's being done by the National Institutes of Health and led by the institute that Dr. Fauci leads, which is the National Institutes of Allergies and Infectious Diseases. And now the FDA is trying to rapidly increase the amount of this drug and be able to open this up for people with COVID-19 infection. So that's a very promising and very exciting development. The last thing, and the governor mentioned this, when we go back out again, wearing face covers is really important. And certainly masks are good, and we want our first responders and people in hospitals and other areas to have the kind of masks that they need to protect themselves. But really a face cover that has multiple layers, like a bandana folded over. And there's a video on YouTube that we can post that shows how to do that in 40 seconds. But if 60% of people wear these kind of face coverings, it really reduces the susceptibility toward infecting other people. And the idea is that these face masks or coverings block the droplet formation, which is how this virus spreads. And so it's not just you wearing it so you protect yourself, it's really people wearing it who may not be aware they're infected. And remember, 45% of people who don't have symptoms are infectious. And if you add the people that haven't been diagnosed, about 70% of COVID-19 is spread by people who are not diagnosed or who don't know they have the infection. So those are my comments. Thank you very much.
Thank you, Dr. Marsh. Next, we'll go to Secretary Bill Crouch with the West Virginia DHHR.
Good evening, everyone. Let me give you a report on our nursing home testing that began last Monday, a week ago Monday. We have tested 96% of the nursing homes in the state. We have completed testing on 89 of those, so we're about to get all of our data in. We have 8 facilities that have started testing, but that's not complete yet, and only 5 facilities yet to begin testing all those. Those have all been scheduled. We look for all of these facilities to be done by this Friday, and this Friday I'll try to give a report on the outcome of those tests. Let me talk another minute about data. Again, we try to be as totally transparent as we can with data. We sent out a press release about an hour ago to try to explain data that on our dashboard, which showed the total number of positive cases at 10 a.m. this morning to be the same as they were at 5 p.m. Yesterday afternoon. The reason for that was because when local health departments go in and begin their investigations, as we've talked about before, there are many times changes to those numbers, including county of residence or even state of residence. So we had some changes there that actually involved 4 counties. We spelled those out in the press release so that we could make sure everyone understood the reason that those numbers resulted in to be identical. Again, we try to be very transparent. We try to provide information for everyone. Several weeks ago, the concern was that we were not providing data as quickly as local health departments. So we published that data from local health departments, recognizing that the investigation still needs to take place and the county of residence or state of residence could change on that. So that's the explanation for that, to make sure everybody's clear. Thank you.
Thank you, Secretary. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Over the next several days, we will focus on supporting best practices development for the various sectors that will begin to phase back in as we move back in to the comeback process. In addition to that, we also will be focusing on building capacity to support the agencies in contact tracing and epidemiology, as well as testing. As Dr. Marsh pointed out, these will be significant in our efforts as we move forward to bring our state back. In addition to that, we will continue to focus on PPE development and sourcing of PPE. Also, for those sectors that need to procure their PPE, we have posted on our website, and we'll post on the governor's site, sources that we have vetted as the state that are available to potentially purchase PPE as you begin to start operations back. Two last items I want to lay out. One is we've been notified that there was a scam effort going around. There was a group apparently sending emails across a Hotmail account to businesses stating that they could get support from the West Virginia National Guard and they would be charged for that support. Please do not pay attention to any of those particular items. If your business or sector needs support, go through your association, your county emergency management office, or your health department in order to get support from the Guard as we move forward in these efforts. In addition, I would just like to say on behalf of the 6,400 Guardsmen in uniform, our families, the 700 civilian employees we have in our retirees, again, as the governor pointed out, we've done a remarkable job, but we've got a lot more work to do. I ask you to pay attention to the best practices, to the guidelines, to work on the social distancing, on the spacing, on the masks, as Dr. Marsh pointed out, and all those things we need to do as we go back to opening West Virginia back up. But we've got to continue to pay attention and double down and do the best to protect our most vulnerable population and our citizens. Thank you.
Thank you, General. Once again, we are holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is David Beard with the Dominion Post.
Hi, David Beard. This question is not so much about the reopening as possibly continuing the feeding program through the summer for the seniors and the students. I think that was mentioned last week or the week before. I'm wondering if we were considering something like I believe it's California is doing with partnering with FEMA to feed those by buying meals from businesses. Is that something that's being considered?
David, absolutely. If I could answer this, I don't have Clayton Birch with me, but you can bet that we're going to continue the feeding program and take care of our kids through the summer. And not only are we going to take care of our kids, we're going to take care of our seniors as well. And so, because it is critically important, beyond belief important, that we take care of our people. And so, you know, our West Virginia businesses are stepping up. They're doing all kinds of stuff, you know, but at the same time, between the Guard, our West Virginia businesses, the Department of Ed, and everybody that's really all in, we're going to take care of our people, the kids and our seniors.
Governor, if I could, David, Governor's tasked us to look at and make sure that we, as he pointed out, that we handle the feeding program for the summer for both our students and our seniors. We've been working several different plans, particularly to source as much of that from West Virginia businesses, because at the governor's direction, he wants us to also use this as an effort as we begin to go back into operations to be able to prime those efforts to help our local businesses going forward. And we'll provide you with more specific details on that over the next several days.
All right, thank you, David. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, it's Steve Adams of Ogden Newspapers here. I got two questions. They're both different, but they're also both pretty easy. I'm getting some questions from churches in regards to, obviously, they're listed on the second week of the comeback plan. But there's a little confusion as to whether they're encouraging their congregations to obviously have PPE, whether it's just a cloth or a face mask, or whether they are being asked or required to provide PPE to congregations. And secondly, I know Donald Trump had brought up the possibility on a call with governors 2 days ago about trying to encourage them to go ahead and reopen school. From what I've read, that kind of fell on deaf ears from everybody. I just wanted to see if there was any chance that we were going to reverse that based on the president's request, or if we're going to stick to keeping schools closed. Thank you.
Okay, Stephen, thanks. And let me take both of these. And I think, in regard to the PPE at the churches and everything, we do not have enough PPE to go around to everybody from the standpoint of administering it from the government. But what we are saying is, from the standpoint of the gathering in the church, we want to go every other pew. Well, there's guidelines out on that, and I'm not going to go through all that. But we need the people to have some form of face covering, while they're there at church and everything. And it doesn't have to be a fancy thing whatsoever. It can just be a cloth with some rubber bands. I mean, it's next to nothing, and really and truly, we hope that our churches will try to assist and help in every way that they possibly can. All kinds of people are stepping up and doing this good work and everything. And in regard to President Trump and going back to school and everything, that's completely off the table with me. That's an impossibility in West Virginia. And I know that may be a possibility in some states, and I can understand, maybe their president coming up with that. But in West Virginia, that's not going to happen.
Hey, Governor, this is Clay. Can I add one thing?
Surely, Clay.
So I also just wanted to point out that this virus has been able to spread through singing, forcible exhalation. So as we are near people and we're singing in church, we need to be really thoughtful about, trying to stay with our own group. And that's another reason why face masks are so important. And if you have a medical illness, or if you're one of the people who is at the most risk, then I might suggest that perhaps you watch online if that's a possibility, or stay home.
All right, thanks, Stephen.
I just want to say, Jordan, the only other thing I would add, if you're Clay Marsh and you're trying to show off singing, don't do it and everything, because I've heard Clay try to sing before, and I just back off on that and everything.
All right, thanks, Steve. Next, we'll go to Anthony Izaguirre with the Associated Press.
Governor, couldn't focusing testing on people without symptoms in nursing homes be artificially lowering the positive rate, since the general public can't get tested unless they meet very strict criteria? And wouldn't using the positive rate almost guarantee reopening, because we would need an astronomical number of new positives overnight to go over 3%, since we're using tens of thousands of old cases? Is it possible for someone to clearly explain why we've loosened the benchmark from 14 days to 3 days?
Clay, I think you got to get this one for sure.
Yeah, sure. Anthony, thank you. And we've been connecting a little bit on social media. So when you come down to it, this is to me the explanation. When you come down to it, we're all looking for a window. We're trying to create gating principles that make sure that we are ready to go back. I feel like the most important gating principle, and this is what Angela Merkel's done in Germany. This is what Andrew Cuomo is talking about doing in New York, and places that have had either good control or had an overwhelming problem with it, is looking at the R0 level, which is the transmissibility, the reproductive number that spreads from person to person, we've gone down below 1 over the last several days. And if you look at our curve, and we talked about 8 days to 14 days in our own minds, and over the last 8-9 days, we've gone down as well, both as a real set of numbers and also as a percent of those tested. And ultimately, as we look at the R not being low, as we look at the rate of positivity going down below 3, which puts us substantially below an average of about 20% around the rest of the country, I think that we're in a bit of a different category. And so as we have had a rate of 4% the whole time, and we're now down below 3%, it gave us more comfort that the penetrance of the virus has not been tremendous in most of West Virginia, certainly in the border areas, Eastern Panhandle, Mon County. And we look at the other active cases, a lot of those are accounted for by outbreaks in nursing homes. The reason why testing nursing homes is so important, and it's not about falsely or truly changing the number as a percent, but it's really about this population is the population that dies the most frequently on many countries in Europe and in our own experience. So it is really incumbent upon us, in my opinion, not only to do this to be very thorough in our testing, but also that this population is the population that has the most high risk of dying and spreading it because they're in congregate areas. And as we keep going, we will continue to expand testing to other, congregate settings, to vulnerable populations, and then to the part of our state that is the most affected. And then eventually what we are working on now is trying to understand that the reproducibility number at a county and community level so we can start to test around that.
All right, thanks, Anthony. Next, we'll go to Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor Justice, what does West Virginia reopening mean for your stay-at-home orders? Is it something that you're considering lifting as we move forward? Would it be a statewide lifting, or would it be piecemeal in certain areas of the state be lifted before others? Where are you on that?
I think, Kenny, in the days ahead, I think tomorrow, you will see some level of lifting and some level of changing and moving toward a safer at home, approach than a stay at home. As we move forward, I think what you'll see is we will have to follow the numbers. And when it comes right down to it, here's how I've perceived and seen the whole thing from day one as far as going back. And I want everybody to really follow what I'm saying right here, because this is really important. You see our numbers are trending below 3, and everybody's just tickled to death. What if our numbers start moving in the direction again? And, I was asked the question yesterday, what if they trend back to 3.5? Well, for crying out loud, if they trend back to 3.5, we got something really bad going on somewhere. And we'll know it, and then we'll adjust to it. And that's what we've got to do. We've got to constantly move in a way that I've said over and over and over, which are prudent baby steps that are moving us in a way of bringing us back to work and bringing our state back to life. But we will only do it. We will only do it if the numbers are right, and the numbers will be right. And I'm very confident that the numbers will be right. But if the numbers would turn wrong, that's why we either slow or stop or back up. And so we'll be monitoring it. We've got these terrific super brains that are watching this stuff all the time, and they're watching every single bit of it. And all of a sudden, if we have a hot spot or we have the numbers that are trending the wrong way somewhere, we're going to be on it, and we're going to be on it with everything we've got to stop it.
All right, thank you. Up next, we'll go to Taylor Stuck with the Herald Dispatch.
Hi, this is Taylor at the Herald Dispatch. Um, Dr. Slemp actually mentioned this recently. We're going to have to keep monitoring in the congregate setting. But now that we're almost wrapped up with testing in the nursing homes, is there a plan to maybe test at a later date to kind of do benchmark testings? Like Dr. Slemp said, that test is just a day in time. So what is the plan to keep monitoring the situation in these long-term care facilities?
Is this Taylor? Is that correct, Taylor? Taylor, this is the governor. Taylor, let me just put it this way. We all know where the most vulnerable are. And we all know that as we have a snapshot as to where we are today, that snapshot can change as we go forward. So, Taylor, what we've got to do, we got to stay on top of it. We got to be in a situation to do continued testing. If necessary, we'll go back and test all over again. As far as expanding that testing, to our daycare workers, to our assisted living people, to our prisoners, whatever it may be, to the African American community, whatever we have to do, we're going to do. And we know the people, where the hot spots are the most prone to happen, and we're going to stay on top of it, and we're going to test and keep testing.
All right, thank you, Taylor. Next, we'll go to Annie Moore with WVVA.
Hi, Governor. It's Annie with WVVA. Do you have any recommendations for employers when it comes to employees who are elderly or immunocompromised? Would you tell some workers to go back to work while telling others to stay home?
Annie, I would tell all of our employers just this. You've got to protect the elderly. If you can absolutely work from home, I would encourage them absolutely to allow people to work from home. But first and foremost, we've got to protect our elderly in every way. If they're coming to a workplace, we've got to social distance, we've got to wear masks, we've got to do all the things that preserve and protect those people.
All right, thanks, Taylor. Thanks, Andy. Next, we'll go to Amanda Barron with WSAZ.
Sorry there, I wasn't quite ready. I wanted to just touch base on what people should do with questions and things like that. Obviously, as you guys have said, once there's one question, 10 other questions pop up. What's the right chain of command in this situation? Is it local health departments? How should people go about getting the specific answers that they need?
Amanda, I'll let some of our medical people jump in, or experts, but you've got a whole fleet of people here that are answering questions nonstop and trying to direct people to areas, if they can't answer the questions adequately. But I would welcome them to call our office here, and I would welcome them to call, the local health departments and whatever. But maybe General Hoyer or Secretary Crouch or Clay, somebody jump in and maybe give more clarity to that.
Yeah, Amanda, on request for specific support from the National Guard, we request that they go through their local emergency management as well as their health department for those types of support. We also have daily outreach with the various associations, so manufacturers, retailers, and others. They can reach out to their specific associations, and as the governor points out, individuals that have questions or concerns can reach out the governor's constituent services, and they pass to the various agencies the questions so that we can do the best we can to answer those.
All right, thanks, Amanda. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hi, everyone. I still think I'm not clear on why we're using cumulative data rather than a rolling data of more recent tests. It seems like if you're using cumulative, you have to have a tremendous spike to ever jump above 3% again. Is that my misunderstanding?
Phil, I'm going to pass this on to Clay and others, but here's my take. Okay, is just individual a day where we had a big spike that went up in a day. We're on top of that. And we're watching that. And if in fact that's an area where we need to directly send our strike forces and everything, we're doing it. We're doing it nonstop. But you know, really and truly, the trend rate, the cumulative rate, to me, is the most valid rate. Now, Clay, you know, maybe you could jump in.
Sure. No, Phil, I think that that you know the governor is right, exactly right from my perspective. You know, I think the key is for people in the state and people that might have some anxiety because, you know, as we do a lot of tests, it does take more positive tests to come back relative to total tests to move that number a lot. As the governor said, if we see it start to move the wrong direction, we know we got some big problems. But we are monitoring every day, and generally more than once a day, a number of different parameters, including number of positive tests on that day, the percent of testing that is positive around the state and in different counties. We look at total versus community spread. We look at the R naught level, as I mentioned before. We hope to get that R naught level at sort of the county and maybe even community levels. And that the R naught is to me a very important additional measure because that really says whether you're spreading it quickly or not. That's the flattening of the curve. If it's less than 1, and if it's substantially less than 1, like ours, which is 0.74, that is a very, very good sign that you've reduced the spread. And that's another metric that we follow every day.
All right. Thank you, Phil. Next, we'll go to Paul Malone with WCBC.
Paul Mullen, WCBC, Cumberland and Kaiser. Governor, how much are you in contact with states around West Virginia, just in conversation, maybe in coordination as you develop your reopening plan?
Well, a lot, but at the same time, you know, I've got to admit, you know, that while we can take resources and advice and knowledge from those around us, we don't want to be them, you know, and so therefore we take a lot of knowledge and resource and advice from the experts that we have right here, plus the fact that we're in constant contact. I'm in constant contact with all those at the White House. I am working with them all the time. We're on the calls with governors and everything. I'm talking to governors and everything from time to time, and you just saw Larry Hogan today, you know, come out and decide, well, we're going to test all the nursing homes. Well, you know, we're way, way, way ahead of that. You know, and we do have a metric, and it's not perfect. I mean, for crying out loud, we all know it's not perfect, but we do have a metric that is science and mathematics to measure. But the net of the whole thing and what you're saying is, I am a guy that seeks knowledge nonstop. You know, I would say that the biggest thing that I think that I have in my life is my ability to doubt myself. So I am constantly seeking additional knowledge. And so my conversations with the governors, my conversations with you know the people, the very best medical experts at Johns Hopkins, you know, whatever it may be, I am constantly on the phone with somebody talking about just how we can make things better for our people here.
All right, thank you, Paul. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor and health experts and everybody. Could you give me and other West Virginians a little more clarity about what you think might be opening tomorrow? There are obviously a lot of medical providers who may be in play to open, but it's not clear to me necessarily which ones are ready. Also, I wonder if there's any more clarity about the testing at daycare centers and where they stand, because they are also in week 1.
Okay, Brad, tomorrow is primarily all the medical providers, you know, and a lot, you know, some of them will, you know, we've told everybody, we're telling them they can open, but we're not telling them they have to open, you know, and so everybody knows that, you know, and so at least I hope they do. And so as our medical providers decide, that they want to open up on Monday, they want to open up a week from Monday, they want to open up tomorrow, that's the network that is really primarily week one. And Brad, I didn't get, the only other thing I would add to that is there are medical boards. There's a dentistry board, and I'm going to mess up the names and everything. But those boards are advising, the dentist or whomever it may be as to what they can do. And so I think like the dental board, has said, we're going to go back on Monday, the 4th, which is great with us and everything. But that's the process. Now, Brad, you asked something else, and I'm sorry, I've lost it for a second.
Oh, hi. Am I still here?
Yep.
Okay, so I was just asking about if there's any more definition of what's happening with daycares. The guidelines that you provided indicated that testing may ramp up at daycares, but what I wonder is more broadly, what advice and guidance is being given to daycares about their timeline?
Well, Brad, here's a situation to where, we totally understand. You got a daycare that's got 100 kids, and it may very well be that you can't afford to open because there's only 10 kids coming. You can't afford to staff your daycare and everything. And so therefore, that's why we don't have any right to impose upon people on what to do. But we need our daycares open and going because so many people depend on them to be able to go to work and let their kids, be in daycare and whatever. And so we need them open, and the DHHR has guidance and are providing guidance, and I think maybe Bill, you could, Secretary Krause could answer this maybe better than I.
Yes, sir, Governor. Thank you. Yes, we have a couple of counties already that are beginning to test daycare workers. We have over 600 daycare centers that are still operating for essential employees throughout the state. As West Virginia opens businesses back up, there will be a need for more daycare centers. We will have some guidance going out to all daycare centers in terms of opening back up and what they will need to do, which includes social distancing and the personal hygiene, sanitation stations, for example. We still have the rule, of course, with regard to the number of people per 1,000 square feet, 3 people per 1,000 square feet for small businesses. There is information on the website now. You can get that through the governor's website or through the DHHR website. So there's information online that's applicable for that.
All right, thanks, Brad. We have time for one more. We'll go to Haley Kosick with Nexstar Media. I think we may have lost Haley. We'll go to Carol.
Okay, wait. There we go.
No,
you guys got me? Okay. I had trouble pressing the mute button. Hi, everyone. Okay, so my question, I'm leaving it up to Governor Justice and the health experts. Can you elaborate a little bit more on the resources you're going to provide these businesses as we open up in week 1, week 2, and week 3? Obviously, it's, like opening up a can, and everybody is just going to want to get their hair cut, get their teeth cleaning and everything. And obviously, this is going to be a lot put on these businesses. So what are we going to do to make sure that they're not stressed and that this goes as smooth as possible?
Okay, Haley, I didn't get enough of your question. Could you try it one more time? I'm sorry.
No, sure. Okay, so what are some of the resources we're going to provide these businesses as they open up, including week 1, week 2, and week 3? Obviously, this is good news, but a lot of people are going to be making appointments to go get their teeth cleaned at, dentists. People are going to want to get haircuts, and this is going to be a lot of stress put on these businesses. So is there anything that we're going to do to help these business owners and try to make this as smooth as possible so they don't get overwhelmed?
Well, Haley, if your question is centering around, are we going to have enough PPE available to the businesses and everything, we're strapped in regard to that. The Guard is working in every way to be able to have additional PPE as we are as well. that could flow to our businesses and try to help them backfill from that standpoint. From the standpoint of how we can help from the government standpoint, to the business as far as people coming to work and everything and their training, the Guard has really worked as far as being able to assist them in properly cleansing and taking care and the actions that would be the most prudent for them there. But someone else, maybe one of my experts could try to answer Haley's question a little better than
Governor, this is General Hoyer. Haley, a couple of things as examples that we are doing. For example, over the last 48 hours, our staff has worked with the local West Virginia chapter of the National Federation of Independent Businesses to put together best practices. Dr. Marsh and Secretary Crouch and I met with representatives from the Dental Board, the Dental Association, and worked with those experts, and they developed best practices for their particular sector. We're continuing to do that sector by sector as we have the manpower to do that. As the governor pointed out, while we don't have the ability to supply PPE directly to certain sectors and private organizations, we've posted on our website and on the governor's website access to vendors that we have vetted that can be used for purchasing PPE. We have a video from the gentleman that Dr. Marsh described, reference making a face covering, a simple face covering. As the governor pointed out, we continue to work with businesses, and we have worked with over 700 businesses in the retail sector so far on practices on the proper wear and use of PPE, as well as sanitization techniques. So a lot of work being done to support those sectors, and the governor's directed us to do a lot more work going forward as we continue to open up sector by sector.
All right, Governor, I'll turn it back to you.
Okay, I would only go back to just this. Everyone's got to know that this. I've been completely honest all the time, and I would tell everybody that this is a pandemic. It's not going to be perfect. It's not going to be. We're not going to be able to perfectly handle it, and that's where we need you. We need you in every way. Now, we've really knocked it out of the park in a lot of different areas, but there's always rough edges, and there's always questions that are difficult to answer. We know without any doubt that in the state of Massachusetts, there was 80, imagine this now, there was 80 veterans that died at one nursing home or at one home. Now think about it. We just tested at our nursing home, at a veterans nursing home in Clarksburg, 306, and we had 0 positive. We're doing a lot of good stuff. We're trying to stay ahead of it, but I would only end by telling you just this one more time. We've lost 40 people now, and it's not good. I hate like crazy to see that more than you'll ever know. It's only a fraction of what's happening all around us, but it's a bad fraction. And I would tell you that we're going to lose more if we don't really, really stay on our game. Please be careful. Please, please take care of the old. And please wear masks and social distance, and absolutely help a neighbor in any way you possibly can. Reach out a kind hand. Reach out by phone or whatever it may be, but reach out a warm meal or a kind hand to be able to help as West Virginians do. You have absolutely knocked it out of the park. But now we transition to another level, and this level with it carries exposure. Absolutely, we're going now to another level. We have to go. We can't stay where we're at. If we stay where we're at, we're going to lose way, way, way more. As we move forward, we can and do and will move safely, But we need you. We need you, West Virginians, to step up again. Show the nation just how good you are again. You can do it. I know you can. Thank you.